Family physicians often feel like they have to be the ones to do all the work when it comes to making sure their teen patients get vaccinated. But the truth of the matter is that the most effective practices actually use their staff. If you're able to activate your staff as champions for you and your vaccines programs, you'll actually do much, much better. An easy way to get your staff involved is using something called standing orders. Standing orders just involve you creating the order ahead of time and make it possible for the staff member to both talk about the vaccine, but also to give the vaccine ahead of time based on an order that you've already agreed on. In many states, this is entirely possible because your nurses don't necessarily need to have you there present in the room at the time that the vaccine is given. They can actually just follow the order that you've already provided. One of the reasons why this is so successful is because it means that the physician doesn't have to remember at top of mind every single visit to ask the vaccine, but instead it can just be part of the protocol. One of the things that we do, one of the checklists when we're rooming the patient, just happens to be to double check their immunization record and make sure that we're offering any vaccines that hadn't been done before. And in this case, using standing orders can be a perfect way of helping our staff become part of our team and really help advocate for our patients and their needs. The idea of trying to start a standing order program probably seems really overwhelming to you. I know that it would be for me. Just thinking about having to figure out how to do all of that work from scratch would be a lot to take in. But the truth of the matter is that we have great resources already available, and we don't actually have to do this all on our own. So, for example, the Immunization Action Coalition actually has a great set of resources that help you to figure out all the steps that you might have to take in order to get a standing order protocol set up in your practice. Let's think about some of the big picture ideas of things that you might have to do, though. So, for starters, you'd want to make sure that your medical leadership is comfortable with having standing orders. In some states, you might need to double check the laws and make sure that it's okay and exactly which staff members are able to participate in your standing order protocol. So discussing this with your medical leadership would be helpful. If you're in a private practice, this might be a quick discussion, whereas if you're in a big system, maybe you have to go talk to a few different people. But it really is important to start out making sure that everyone's on board and that what you're going to do is going to be within the legal bounds of what the patients and the staff are expecting from the regulations in your particular state. Once you get your medical leadership on board and you know that everybody's fine with having it done, your next step is probably going to be to pick a champion. Now, you might want to pick you as the champion because you're already excited about it and you're the one pushing the standing orders, but the truth is you don't have to be the champion. You actually could use this as an opportunity to identify one of your nurses or your medical assistants who are really passionate about taking on a new leadership role, and use this as an opportunity to help them get some leadership exposure and figure out how to lead a really nice project within your practice. Your next step is going to be pulling together a team of folks to make sure that the protocols actually cover all the bases and the things that they need to know. So, for example, what the physician might think is important to include in the protocol may not answer all the questions that your medical assistant or even your office front staff person might need in order to effectively implement the protocol. And so you want to have all of them available in the room to sort of have that conversation ahead of time and make sure that you're all on the same page about what everyone's responsibilities are going to be, what you would do if there was a problem, or even if the patient had questions, what were you going to answer the questions? How are you going to handle that situation? So having everyone together in the room to draft and write that policy is a great idea, especially if you do it up front so that everyone feels like they're a part of the process. Then you want to take your policy back to your medical leadership and just make sure that what you all have come up with is still sort of copacetic with all the things that you need to get done. And then you're going to want to roll it out. Rolling it out is going to be as simple as deciding the day that you're going to start and then letting everybody get started. For some practices, they might find it helpful to do a dry run. You just sort of pretend like the patient's showing up. Walk through what everyone's step would be and actually practice it to see where you might fumble or trip over in the beginning. Other practices will just go live on the first day and just handle it as it comes. Do whatever feels right for your practice. But if nothing else, make sure that at some point you tell the patients that this new process is in effect. You know, for some patients, it might be a little odd to have the nurse asking them questions about their vaccines before you've even come into the room, or offering to give a shot when you're not even in the building. Well, and for those places, you might want to make sure that you've let the patients know and help them know that you're actually looking at the best ways to deliver care for them in your practice. One of the nice things is that you have access to a large variety of resources. Keep in mind that you don't necessarily have to create the resources for marketing or talking to your patients on your own. You have access to the Highlight on Vaccinations for Teens resource library. In that library, there are a wide number of tools that you could use to help market this new work that you're doing to your patients, including postcards and appointment reminders, even social media tips that might help you use things like Facebook or Twitter a little more effectively. All of these tools can be used to help market the fact that you're using this new standing orders program or that your practice is one that supports vaccinations in general.